Thank you for inviting me to speak about what it means to put health and well-being at the center of our economic systems. I had the honor to chair the WHO, World Health Organization Council on the Economics of Health for All during COVID with a wonderful group of council members who happened to be all women. When Dr. Tedros and I were asked, why are there only women? We said, why not? And I can tell you that it was absolutely because I chose the most important women, I think, who are actually thinking about this topic from different perspectives. And what we did for 2 years was to ask ourselves, it's not enough to just say invest in health and it's good for the economy. What does it mean to say health for all, well-being for all is the goal, and then backtrack and organize the economic system to deliver on that? And what I've been trying to do in my work is very much related to that. And I want to kind of start backwards a bit with first principles. Ultimately, this requires shaping our economic system and not fixing it. Why am I using these words? Because in traditional economics, we have justified policymaking as fixing market failures. And already in the entrepreneurial state and looking at the role of state investments that actually led the way around the IT revolution, the value of everything, and how that requires a theory of collective value creation, mission economy that I'll be talking about today, what it means to create well-being and health for all missions, and in the big con, thinking about the public sector capacity and the implementation capacity we need on the ground. I've been thinking a lot about these issues, and hence again, why it was so important for me to be able to contribute during COVID around some of these themes, but again, putting health and well-being for all at the center of that thinking. And this is also related to some work that I've been doing with my team at University College London around outcomes-oriented and mission-oriented strategies. And I want to, again, just spend a bit of time in talking about that. Ultimately, thinking about outcomes is very different from just thinking about outputs. And the more bold and ambitious those outcomes are, what I call missions, the more we then need to rethink how we're designing policies to be mission-oriented, redesigning tools and institutions, whether it's procurement or state investment banks, that new social contract between public and private actors, bringing communities to the center of some of these governance processes, as including designing the missions together, but also those much needed dynamic capabilities. So these are the different areas that need to be unpacked if one is thinking in an outcomes oriented way. And missions, again, are very useful in terms of almost reversing the usual logic. So if we're thinking of health and well-being, some people might focus on just some sectors, whether it's the pharmaceutical sector or with climate change, the renewable energy sector. That's not what missions do. Missions require many different sectors to interact on solving a problem. In the same way that the moon landing was not just aerospace, it required different types of solutions to what the astronauts were wearing, what they were eating, how they were going to the bathroom. So that idea of starting with a grand challenge that could be health and well-being, and then turning it into a mission, which, for example, during COVID, was making sure that everyone around the world had access to vaccines, and then making sure that that actually requires different sectors, but also different government departments to work together, and that all of government way, but also all economy way. And making sure that then we spend time on thinking what it means for procurement, for loans, for grants, for subsidies, to crowd in bottom-up innovation towards mission accomplished. And back in 2018, I worked on this topic with the European Commission, with Carlos Moedas when he was ahead of the DG for innovation, using an example like climate change, 100 carbon neutral European cities by 2030. And again, thinking through what it would mean to move away from a sector-specific innovation strategy or a sector-specific industrial strategy towards an intersectoral one. And you see here different sectors that are critical to carbon neutrality, from energy, mobility, food, construction. And again, that bottom up, I repeat bottom up because missions are not about top down, they're about clear direction setting and bottom up experimentation towards mission accomplished. And the more bold and inspirational they are, the more clear the direction, the more cross-sectoral and driving those multiple bottom-up solutions, the more ultimately this also creates growth, right? Growth is an outcome of public and private investment. And in many low growth countries, the problem is also low investment. But how to steer that investment, think of directed growth, that's why we need missions. And again, coming back to this wonderful commission that had the honor to help set up with Dr. Tedros and then to chair. This is very much what we ask. What if the mission was health for all? What if the mission was well-being for all? How do we move away from just human and social capital, or seeing health as a byproduct of economic growth, towards health itself as the goal, as a human right and a goal for the economic system? And what we did was we broke down this work around 4 different areas in terms of thinking about what it means for the economy to deliver on a health for all goal. What does it mean for how we value, including how we, replace GDP with a dashboard in terms of not just replacing it with one number that we think is a little bit better, a little bit worse, but a whole dashboard of different metrics, but also how we value those people working in our health structures. We clapped our healthcare workers during COVID, but we continued to under-resource the structures within which they worked, but also the pay structures, and literally didn't value those essential workers, except for a very short period in history, and then forgot. What does it mean for how we innovate? If there's a goal, then what does it mean for the public-private innovation system in a goal-oriented way that will actually then drive, for example, how we share the knowledge, how we structure patents, not to be too wide, too strong, and too upstream, as they often are. What does it mean for financing, the structure of finance? We can't just keep talking about financial gaps. We need to shape finance. We need to pay as much attention to the quality of finance. And again, this issue of public sector capacity, which has been a bit of my obsession, because it's not just about big state, small state, it's about the dynamic, capable state structures that can also then work well with the private sector and also the third sector, of course. And we have a whole summary of recommendations, which I won't go into here, but they were very much broken down into these 4 different areas of valuing, innovating, financing, and strengthening public sector capacity for health for all. And part of the issues around finance, for example, was how do we make sure that even when we have the patient finance and not just the inpatient finance, which is part of the problem, but the patient finance, that it's more directed. There's huge amounts of public money globally, for example, in public development banks, much more in the national banks than the multilateral ones. But currently, these funds are not being directed in a goal-oriented way. So in a recent report for UNDESA, I wrote about how there could be a much stronger outcomes-oriented relationship between the multilateral and the national development banks, precisely around objectives like health for all. And that creates, of course, a multiplier effect if then the national banks have more conditionality when they are lending out to the private sector, to make sure that those companies that are receiving those loans are themselves doing their bit. So moving away from a picking winners towards a picking the willing around big, bold objectives. Procurement is a very important lever in any country, whether it's a small island state or a large nation. Procurement is often up to 30% of government budgets, but when it's used to actually be in a goal-oriented way around, again, health and sustainability goals, that actually requires more investment, which again is a key driver of growth. So think of school meals. Instead of just thinking of school meals as a welfare state kind of provision, turning it into also an innovation state provision means that there has to be kind of a moonshot around that. So healthy, tasty, sustainable meals for every child in a country requires really thinking in an outcomes-oriented way that also then affects the food system and that relationship between the public and private actors. At the center of this, as I mentioned, is a new social contract. The word conditionality seems a bit heavy-handed, but it really is about reciprocity, mutualism, symbiosis between different actors that can really be at the center of any contract. Think of water rights. Water rights are often given by the state to the private sector, and yet 80% of industrial wastewater is not recycled. Put it in the contract. And so for any private sector company to be benefiting from a subsidy, a grant, a loan, a water contract, an intellectual property right, a procurement contract, do it in a goal-oriented way. And those companies that are willing will get extra support, but not just to, stay in place, but to move in that direction. And this is also why it was so interesting to look during COVID. There was really just one of those vaccines during COVID, the AstraZeneca one, that worked with the Oxford University taxpayer-funded researchers that was in fact goal-oriented. And it was because those researchers put it as a condition for their collaboration with AstraZeneca that they had to ensure access and knowledge sharing, because the goal was not just vaccines, it was, again, making those vaccines accessible to the world. So producing them in the developing world required then the way they collaborated to focus on knowledge governance. As I mentioned, I really believe in implementation capacity. This is Theodore Agnew you see here, who was a Tory Lord, who during COVID just looked at how much was being spent during COVID on outsourcing the kind of governance, even of the infodemic side. Deloitte in the UK got 1.5 million a day for the test and trace system, and they didn't do too well. And learning from that, the need to invest within government structures in order to work well with others. This is never just about government, but capacity is key. And we really brought all these different recommendations to the center of WHO, but also during the World Health Assembly in 2024, a year ago, there was a resolution that was passed on the economics of health for all, giving a mandate for the implementation of the recommendations that we put forward in the council. So this was great news, and it's really important now to find places to start implementing, sandboxing these recommendations around valuing, financing, innovating, and strengthening public sector capacity for well-being, for health for all, and making sure we also have governance structures globally that can do that. And for this reason, I'm also happy to announce that in my particular role right now as an advisor to President Ramaphosa for the G20 process, we're also trying to bring this thinking to the center of the G20 process, which, because the themes for the G20 are solidarity, equality, sustainability, with issues around inclusion going across all three, it's a real opportunity to bring achieving health for all to the center of a global discussion that goes across ministries, across finance, across industrialization and growth, employment, and inequality issues. Health for all involves us all, involves all government departments and a whole economy approach, which is absolutely central. And I hope these comments have been useful for your conference. Thank you.
Thank you.